Hey there, and welcome to another Chairside Chat with me, Michelle Strange. This week brought to you by Zirc. So isolation and aerosol management is the topic that I'm so happy to talk about. I knew this was an important topic that we needed to address, and now it's like all we're talking about, and I love it. Zirc has made many isolation products for every clinician on the team, like everyone. From restorative to surgical to hygiene, they have it all. And I would love to highlight a few of the isolation items that come in the Isolation 360 Power Pack from Zirc. It's a great way to try out the many items that they have to make your job and aerosol management, you know how I love to talk about it, so much easier. So let's get into it. Okay. First, we have the rubber dam. I can't speak to this personally. I'm not a restorative hygienist, and I've always worked in, surgical practices, but word on the street is they're pretty fantastic, and they come in two sizes that are available to you. And they're already like on the thing. I'm not even going to try to call it what it is. And then we have the very popular Mr. Thirsty One Step, which has the bite block and the suction all in one piece, and it's entirely disposable. And you can actually check out my past Chairside chats on this to get more details, including the little tiny baby one that they have now. Okay, and then we have the Lingua Fix, which is amazing. I use this in a sealant clinic, and if you know me, you know I'm not fast with sealants or ever do them. So I was so happy to have this. So it hooks to your saliva ejector, and then you put this down into the floor of the mouth, and it pulls it out there, and then this hooks to the chin, kind of like this. So it stabilizes. It's so nice. This is Pink Petal, which fits on your low volume suction to provide that continuous hand-free suction with no additional attachments. So you just place it in the buccal side of the cheek, and the Pink Petal holds the saliva ejector back where you need it, which is in the corner of the mouth where all the pulling happens. Smart. And then we have the SE cushion. This was something I used as a sample once and didn't save the package, and I was so mad because I loved them and I was so excited to find them again. It helps prevent the tissue from sucking into the saliva ejector and prevents the hickey that you give the inside of the cheek. So it just fits on the top of your saliva ejector. It's so great. And then we have this device called the Airway Armor. I wish I had this when I was a surgical assistant, because changing out implant components always gave me anxiety. I had to be ready with that suction if anything dropped. So Airway Armor fits comfortably in the mouth, and it protects the throat. And if you've ever had to check to see if your patient passed an item they have swallowed, then you know this device is worth every single penny. And you can learn more about all of these products Zirc offers for isolation and airway management at zirc.com. Just click on the products tab and head to isolation. Well, thanks for hanging with me for another Chairside Chat. And, always let me know if you have any questions. And also, don't forget to head over to zirc.com.